For too long, women have been told to simply endure the symptoms of perimenopause and menopause as if it's just part of getting older. This narrative has left many feeling isolated and powerless during a profound hormonal shift. But you do not have to suffer in silence. You deserve to feel well, vibrant, and in control of your health. The idea that discomfort is a rite of passage is outdated and medically unsound. The hormonal changes of midlife are not just about hot flushes. They represent a significant deficiency that can impact your long-term health. Estrogen, progesterone, and testosterone are vital for your brain, bones, heart, and overall well-being. Ignoring symptoms is a disservice to your future self. Seeking help is an act of strength and self-advocacy. Imagine being told to just endure diabetes or thyroid disease. Unthinkable, right? Menopause is not an endpoint. It's a new chapter, and you have the right to enter it feeling empowered and informed. This video is about giving you the knowledge and confidence to make the best choices for your health. You deserve relief, and you have options. So what is HRT? Simply put, hormone replacement therapy replaces the hormones your body is no longer making in sufficient amounts. As menopause approaches, your ovaries produce less estrogen, progesterone, and testosterone. HRT restores these hormones, easing symptoms and supporting your health. Estrogen is the main hormone in most HRT, vital for temperature regulation, skin, brain, bones, and mood. HRT comes in patches, gels, sprays, or tablets, personalized to your needs. If you have a uterus, you'll also need a progestogen to protect against womb cancer. Progesterone can be taken as a capsule, patch, or hormonal coil. Women without a uterus usually need only estrogen. Testosterone, though often overlooked, is important for energy, mood, and libido. It's usually prescribed as a gel or cream in small doses. HRT is about restoring balance, not adding something unnatural. It's a comprehensive approach to feeling like yourself again. Hormonal decline can disrupt every part of your life, physically, mentally, and emotionally. HRT is highly effective for hot flushes and night sweats, helping you sleep better and feel more comfortable. It can also lift anxiety, low mood, and irritability by supporting your brain's feel-good chemicals. Many women find their joy returns as HRT restores emotional balance. Brain fog, trouble with memory, focus, and word finding often improves with HRT. Estrogen is crucial for cognitive clarity. HRT also relieves vaginal dryness, discomfort, and frequent UTIs, especially with local estrogen. Joint and muscle aches often ease, as estrogen supports connective tissue and reduces inflammation. These changes aren't just in your head, they're real, and HRT can help. You deserve to feel like yourself again. Fear and misinformation keep many women from considering HRT. The biggest myth? That HRT dramatically increases breast cancer risk. This fear comes from an old study that's since been reevaluated. Modern HRT is much safer, especially for women under 60. The increased breast cancer risk with combined HRT is small, similar to risks from alcohol or being overweight. Estrogen-only HRT has even less risk. HRT doesn't cause cancer. It may stimulate growth in pre-existing hormone-sensitive cells. Regular breast screening is important for all women, HRT or not. Another myth: menopause symptoms are just something to live with. Not true. These symptoms signal a hormonal deficiency that can affect your long-term health. Treating them with HRT is a valid, proactive choice. Some worry they'll be on HRT for life. In reality, duration is personal and reviewed annually with your doctor. You can stop HRT gradually if you choose. The decision about when to start, continue, or stop is always yours. Don't let myths hold you back from feeling better. Making an informed decision means weighing benefits and risks. For most women under 60, the benefits of modern HRT far outweigh the small risks. The biggest benefit is relief from life-disrupting symptoms, restoring sleep, work, relationships, and your sense of self. HRT also protects your bones, reducing the risk of osteoporosis and fractures. It can lower your risk of heart disease, especially if started within 10 years of menopause. Estrogen helps keep blood vessels healthy and cholesterol in check. HRT may also reduce the risk of type 2 diabetes and improve skin, hair, and vitality. Risks include a small increase in breast cancer and blood clots, mainly with oral HRT. Transdermal HRT, patches, gels, sprays, avoids the clot risk and is now preferred. Honest conversations with your doctor help you make the safest choice. For most, HRT is a safe, effective way to reclaim your well-being. HRT is safe and suitable for most women struggling with menopause symptoms. If you're under 60 or within 10 years of your last period and your symptoms affect your life, you're a candidate for HRT. Even women with migraines or well-controlled high blood pressure can often use HRT, especially transdermal types. A family history of breast cancer doesn't automatically rule you out. Discuss your risks with a knowledgeable provider. HRT is usually not recommended if you've had hormone-sensitive cancers, active liver disease, unexplained vaginal bleeding, or a history of blood clots. Timing matters. Starting HRT under 60 is ideal, but older women may still benefit after careful assessment. If you started HRT younger and feel well, it's often safe to continue past 60 with regular reviews. The key is a personalized assessment with a doctor who knows the latest evidence. Your health, history, and preferences all matter. The decision is always yours. Exploring HRT starts with a straightforward consultation. Book an appointment with a provider who understands menopause. Prepare to discuss your symptoms openly. Keeping a symptom diary can help. Your doctor will ask about your symptoms, medical history, family history, and periods. For most women over 45, diagnosis is based on symptoms and age. No blood test needed. Hormone levels fluctuate too much for a single test to be reliable. Treatment is based on how you feel, not just numbers. Basic health checks like blood pressure and BMI are routine. Additional screenings may be recommended based on your risk factors. This assessment ensures HRT is safe and tailored to your needs. HRT is the most effective treatment for most, but it's not the only option. Lifestyle changes, regular exercise, a balanced diet, and stress management benefit everyone. Weight-bearing exercise protects bones. Cardio boosts heart health and mood. Diets rich in whole foods, calcium, and vitamin D support overall well-being. Phytoestrogens in foods like soy and flaxseed may help some women. Local vaginal estrogen treats dryness and discomfort safely, even for many breast cancer survivors. Non-hormonal medications, like certain antidepressants, can reduce hot flushes and improve mood. Herbal remedies and supplements may help, but discuss them with your doctor. Mind-body practices, CBT, mindfulness, yoga, can ease psychological and physical symptoms. There are options for every woman, whatever your needs or preferences. Menopause shouldn't be a silent struggle. The era of just tough it out is over. Your symptoms are real and deserve care. You have the right to feel well and to access treatments that help you thrive. Knowledge and self-advocacy are your first steps. For most, HRT offers profound relief and long-term health benefits. Whether you choose HRT, lifestyle changes, or other options, make the choice that's right for you. Find a provider who listens and respects your concerns. This is your body, your health, your future. Midlife is a new beginning, full of potential, growth, and joy. You have choices, and you do not have to suffer. If you found this helpful, don't forget to like, follow, and share at Leap to Better Health. Let's empower more women together.